Hi, this is Eric Lamar, and I'm here today with Monica Grajales, the founder of the Institute of Holistic and Transformative Aesthetics. In the Florida area, she is considered the go-to person when it comes to providing services and training on intimate skin bleaching, commonly known as anal bleaching. Today, we're talking about safety. Monica, how are you today?
I'm doing well, thank you. How are you doing?
Awesome. You have such an amazing, clean facility here, which is perfect for this topic that we're going to be talking about of safety. When it comes to safety in this area of services, what's the number one thing that must be considered for a person's safety?
The first thing is to take a thorough consultation and history of the client so that we can be sort of prepared of, what to expect from the client. The second most important, which some people would consider the first, but the first would be consultation, is the proper use and disposal of the gloves.
Do you wear gloves?
Absolutely.
So why is that so important?
Well, we may come in contact with pathogenic organisms, meaning since we're working with the intimate areas of a person, a lot of sexually transmitted diseases are asymptomatic, meaning that the person himself or herself might not know they have one, and we might come in contact with that. Also, there is a potential for HIV infection, so we need to protect ourselves and also the client.
So these particular gloves, is there a particular kind, and are they medical grade gloves?
We definitely use medical grade. Now, we have to make a distinction. There is, within the medical grade gloves, we have the surgical and we have the examination. We don't have to use surgical gloves because we're not operating on anyone, but the examination gloves is what we would use. But we also need to keep in mind that there are three different kinds of examination grade gloves, so we just need to choose the correct one.
Great. What is the difference between them?
So there are latex, which is made of natural rubber, vinyl, which is the equivalent to latex but in a artificial form, if you will, made out of PVC, and also nitrile gloves. The difference between them is the level of protection and the tactile sensitivity. They're all comfortable, they're all flexible, they're all soft, they fit comfortably. But latex has the best tactile sensitivity because they are the thinnest. They are preferred by surgeons. However, they sometimes, a lot of times, cause allergic reactions, anywhere from a rash to respiratory problems. So we don't want to use that because we don't know if the person might be allergic to latex. The second one would be vinyl, and the level of protection is it's standard, not excellent, but it's standard, and it provides a little lesser tactile sensitivity because it's a little thicker. The third one would be nitrile, which is the safest one because it has a 10 millimeter barrier protection of thickness, so punctures and chemicals are more difficult to go through, but because they're so thick, the tactile sensitivity is much less. So they all work, it's just a matter of what works best for the esthetician and for the risk that they're going to be exposed to.
What about powdered or non-powdered?
That's also something that we see a lot on the boxes, and we like, what's the deal with the powder? Well, the powder is simply a lubricant to make easier to insert the glove on your hand. The problem with the powder is that if some powder gets in an open wound area, that might affect the healing process of the wound.
Is there a special way to remove the gloves?
Absolutely. If we have bodily fluids or blood on our gloves and we just remove them without proper care, we are defeating the purpose of wearing gloves. So I'm going to show you how to properly remove gloves and dispose of them.
All right. Well, let's see that.
All right. So I have my gloves. I keep them tightly enclosed so that they don't come in contact with any dust. The kind that I use are PVC. And I like to wear them. Actually, I'm going to remove my ring. And I use non-powdered. I don't want any powder getting into someone's skin. All right. And I like to make sure that they're completely unrolled for higher level of protection. Okay. So let's pretend we have something on our gloves. We don't want that something to touch our skin whatsoever. So what we're going to do is from the inside of our arm, we're going to make a little pocket, lift the glove without touching the skin, make a little pocket, and with our fingers, remove the glove and flip it inside out. So that way our skin doesn't touch. With the glove that we still have on our hand, we're going to make a little ball. And then with our other hand, with our bare hand, we're going to go under the glove this time. And we're going to do the same procedure without touching the inside of the glove. Now we have both gloves on the outside. We're going to make a little ball and dispose of them.
Wow, that's perfect. So I can see why that's so important as far as not transmitting or subjecting yourself to anything that's dangerous.
I've seen a lot of estheticians properly using the gloves, but I've also seen them removing their gloves without being aware of how to do that purposely, and that defeats the purpose. So that's the reason why we are creating this video, so that we can create awareness.
Thank you so much for providing this powerful information. The next time you want to make sure that you're getting trained properly or receive wonderful services, be sure to contact Monica at the Institute of Holistic and Transformative Aesthetics.
Thank you so much.